you very much. I just going to take just a couple minutes of your time, tell you a little bit about what we do and a little bit about what we're finding in the industry. First of all, make sure that you all know you're invited tonight, and your students and friends, to Iron Cactus at 7 o'clock tonight. We hope to see you all there. And I've heard that afterwards, when our time is up, there's karaoke there. So even if you don't sing, you can have a good time. So thank you. Thank you very much for all you do and all the hard work. I can only imagine. I know some of you pretty well, and I hear about day in and day out your labors. I'm Jill Gilliland. I'm CEO of Melnic Consulting Group. We're a pediatric nurse recruiting company. We recruit nurse practitioners, clinical nurse specialists, and nurse leaders. We work nationwide with children's hospitals and facilities, and we tend to have more specialty care physicians, but we talk to nurse practitioners and primary care, and our primary purpose is to help nurse practitioners find a job, whether we teach them how to do it or find it for them. And one of the most exciting times and challenging times in healthcare is demonstrated by the rigorous debate in Washington. Your valiant and tireless and extraordinary efforts are applauded by Melnic Consulting Group. And it's just kidding. We're here to help you with services and support as your students transition from the educational environment to the workforce. We have the expertise to navigate your students through the transition process into the workforce, and we will come and help you in your school with on-site meetings with your students, or we can do it online. We've met with some of your students online or through discussion threads. We'll review resumes, coach for interviews, and help with job search strategies. We evaluate their personal considerations and their professional goals to help them transition into the workplace. You'd think that would be a fairly simple process, and some of you remember a long time ago moving from an RN to a nurse practitioner, but you probably know it's very challenging, both emotionally and intellectually. And it requires a very supportive, intentional process. And so for them to find the right place, feel empowered and knowledgeable in the process is very important. Some of the ways you as educators contribute to the overall satisfaction and productivity in the workplace is through your articles. And you serve to educate employers and physicians about the scope of practice, just the definition of the role, and the transition process. And I want you to know how important that is, because you would think they would understand, but they don't. And we did a survey, and there's a very strong correlation between the understanding of the physician and the workplace environment of the role of the nurse practitioner and job satisfaction. Hospital employers are asking for more and more acute care pediatric nurse practitioners and specialty care. We anticipate, or through our reviews of information, a 25 to 75% increase over the next 5 years in specialty care, and somewhere probably around 25 to 30% increase in primary care, partly because of the changes in healthcare and people retiring. There's also a strong increase in demand for clinical nurse specialists. So I haven't talked with a number of you about your clinical nurse specialist program in pediatrics, but we do have a number of positions. And one thing that happens is when the positions are out there long enough, they take them down from the website, but they're still searching. Part of what I'm hoping hospitals are anticipating is there will be a large number of nurses retiring, and they know there's going to be an influx of new grads, and they really are dependent on the CNS to keep that workforce strong and reliable and safe. Because of the collaborative effort and advocacy by NAPNAP and you working with other nurse practitioner organizations, from all the information that I'm seeing, nurse practitioners are becoming a really important provider in the solution to healthcare. And as a result, the demand's going up and the need for education is really strong. So I was trying to come up with a guess, but I'm going to say at least one of you mentor 3 of you, and we may be able to provide enough educational support for the demands in the workplace. Working together and leading change and effort To advance the profession of nurse practitioners will require exceptional collaboration, awareness, and empowerment. I'm attending the University of Pennsylvania right now at the Wharton MBA program, and one of our leadership classes, Jim Collins wrote a book called Good to Great. And in it, he discusses the concept of the flywheel, and he talks about the relentless pursuit of a push of a giant heavy flywheel in one direction, building momentum to a breakthrough point and beyond. So I want to leave you with 3 ideas. Be empowered and empower. Work collaboratively and teach collaboration, and build your own portfolio and teach portfolio building. Your task is big and your efforts are stupendous and your leadership is outstanding. Melnic Consulting Group wants to thank you for leading the future of nurses, and we want to partner with you in Nurses Futures. So if you have any questions or comments, we put out our business card. Please feel free to call us, talk with us. We want to be here to help you, support you, and have a fun party tonight.